Patricia.
Hi, nice to meet
Nice
you.
to meet you. I'm Sarah.
Hi.
Welcome to UltraSlim treatment.
Thank you.
So why don't we start by you telling me what it is that you're here for today?
Well, my main goal is to get rid of this belly, but I also have my inside of my thighs are really bad. So I definitely need work on that, and then my belly. And of course, you know, with that comes the sides and sides of your hips. So that's what I need done.
Okay, well we can certainly help you with that. I'm confident we'll be able to get you some excellent results.
Oh, fantastic.
We'll probably be doing a course of treatments with you.
Okay.
But you will see results here today before you leave this office. So we'll start with that.
Okay.
Okay, sound
Great, I'm
good?
excited, yes.
Let's
yes.
get going.
Thank you, okay. Thank you.
This way. Right, so before we get on to the treatment itself, it's time for those all-important measurements.
Okay.
Right?
Yeah.
So I need you always stood in one consistent position to make sure I can get these accurate for you.
Okay.
So if you can put your toes together for me.
Okay.
And
Like this?
That's perfect.
Okay.
And your hands up at your collarbone like this. Okay.
Like this?
Thank
okay.
you. Now I'm using this tape measure, which is a tension spring tape measure, because it gives me the most accurate results rather than having to worry about how hard I'm pulling or if I'm getting that wrong. Each measurement is different on every person, so we will just move that about a bit just to make sure we're measuring your target areas. I do need to mark your skin, is that okay with you?
That is fine. Yep.
Thank you.
Fine.
Right, so this measurement, which is actually looking at primarily the area around your back as well as the front, is 31 6/8.
Okay.
If you need a break for your arms at all, just let me know.
Okay,
I know you might start to ache.
I will.
So what I'm also checking as I do this is that the tape measure is straight, it's parallel to the floor, it's not caught on you anywhere, because all those things can distort the measurements, and of course that's the last thing we want for you. Try that one again.
Okay.
Again, I'm just going to mark your skin. I'll be doing that each time for each measurement.
Okay.
That's so that when I come back to measure you next time, it's always going to be in that same area, so we know we're measuring the same place each time. So this waist measurement is 31 1/8.
Okay.
I'm still good?
Still good.
That's what I like to hear.
In the problem area.
So down to the tummy. What I may just need to do, if you're okay with that, is just adjust your waistband of your underwear slightly. I want to make sure that's not distorting my measurements
No,
in any
not a
way.
problem. Not
Thank
a problem.
you. So this tummy area, the lower abdomen, is 34 7/8.
Okay. Problem area.
Well, on to the next, we're going to be doing round your hips and your bottom.
Okay.
Let's make sure that's not twisted in any way, because again, that's another thing that would affect that measurement for you.
That makes sense, okay.
So right there, that was not straight at all, and that's exactly the sort of
Okay.
thing I'm looking for you.
Thank you.
No, we've got to get it right. This is what it's all about, getting you those results. So this bottom and hip measurement is exactly 43 inches.
Okay.
I'm going to move on to each of your thighs now, so I'm just
Okay.
going to need you to widen your stance for me slightly.
Okay.
Give those arms a shake.
Yeah, I have to a
Loosen
little
them out.
bit.
That is fine.
Okay.
Perfect, thank
All
you.
right.
I'm going to measure the distance that your feet are apart as well, again, just to make sure we're always measuring
Oh, sure.
accurately for you. So you're stood 11 inches apart.
Okay.
So let's start with this thigh for you. So this was that target area in particular for you, wasn't it, Patricia? That thigh
Yes,
area.
very much so.
And that's exactly what this treatment's aimed at, your waist, hips and thighs. So
I can't
you should be
wait.
getting all those areas. So this thigh measurement is 24 7/8.
Okay.
And on to the next thigh. This is where we see how even your thighs
Yes.
are. It's really normal if it's
not.
not actually accurate. And of course we may be measuring in a slightly different place on each leg, just depending on, again, exactly where that target area is. So we have exactly 25 4/8.
Wow.
So that's all the measurements done for you.
Okay.
And now on to the treatment time.
Excellent.
Are we
Okay.
ready?
I am. I'm ready.
Perfect,
I'm ready.
let's go.
Okay.
Right, we're ready to start the treatment now.
Okay.
So what we want to make sure is that we are targeting all those areas for you. So you might just want to consider moving your waistband slightly further down just to make sure we're exposing all that lower tummy.
Okay.
Perfect.
Okay.
And then
Okay.
if we put your hands up behind your head like this, and
Okay.
you just relax there and let the light do its work.
Thank you. Yes. Thank you.
We also need to bear in mind that the light will treat any area that's exposed, and we don't want to lose anything you don't want to.
Oh no.
So I will just use this final cover to cover your chest area.
Okay. Thank you.
Let me position that for you. And if you're comfortable there, I'm going to position the light and we'll get going.
Thank you.
So again, what I'm doing now is just making sure that we are going to hit all of those target areas from that very top measurement down to your thighs. You ready for me to turn it on?
I am.
I always warn people it is a little
Okay.
bright, but it won't do any harm to your eyes whatsoever.
Okay.
So you don't need to worry about wearing any glasses.
Great. Thank you.
So let me check the positioning of this light for you. Perfect. So that's 8 minutes, and I'll
Okay.
see you then.
All right. Thank you. I am. Thank you.
Excellent. So we're now going to move on and treat your side.
Okay.
So what I want you to do is just roll over away from me onto that right hand side. I'll hold this in position and put it back where we need it.
And where do you want my hands or my hands?
So exactly like if you leave your top hand up, put your back hand up behind your head like this. And that's perfect because we don't want your arms down covering any of your tummy or any of your sides.
Okay.
So with your legs, I'm just going to come around to here. I want you to stretch your top leg out straight.
Oh, here. Okay.
Yes, the opposite way to what you often expect.
Okay.
And exactly as you are, bend that bottom foot up to touch your kneecap. And now what we're doing there, is that comfortable?
Yes.
It's so that we can expose that inner thigh area. So one of your problem areas, we want to make sure the light's hitting there. If you then just roll your pelvis slightly towards me. Perfect. And by tilting backwards, again, we're targeting again some of this tummy inside area.
Great, thank you. Look how it needs it.
Well, that's what we're here for,
exactly.
So I'm going to just make sure this cover's in place for you. Reposition the light, and then you know what's coming now, another 8 minutes.
Yes, all right.
If you just tilt slightly further back for me, just pop your hips slightly further back towards me if that's comfortable. That's just perfect. We've got, again, that good angle, just so, like I said, we're hitting everywhere we want to. Ready to go?
I am.
Perfect. It's always important just to make sure once the light's on that again we are exactly where we want to be for you. See you soon.
Okay.
I'm back again.
Okay.
So we're now going to treat your back. So I need you to roll over onto your stomach for me, and I'll just move this cover out the way because you won't need it this time. So again, before you actually settle down, a bit like when you were we're treating your front, you might just want to adjust your underwear to make sure we're treating every bit possible.
Okay.
So you feel free to move it up, down, whatever you want, but just bear in mind that what's exposed is what's getting treated.
Okay.
So that is perfect.
Okay. And arms up.
Yes,
Here
just
again?
relax.
Okay.
Hands up there is absolutely
Great.
fine.
Okay.
What I'm just going to do as well is perhaps just, if you would like me to, I can undo your bra strap just to make sure we're covering that back area.
Sure, that would be great. Thank you.
I'll strap you back in before we
Okay.
finish. So again, just going to make sure the light's positioned correctly. And that's the thing, it's so easy to move these up and down. We can make sure we're exactly where we need to be for you.
It's very comfortable too.
Good.
Not feeling any heat or pressure, or it's just.
Well, perfect, exactly. There's
comfortable.
no kind of side effect, there's no discomfort, is there? So it just makes it that little bit nicer.
It does.
Are you ready to go?
I am.
Perfect. So just again checking that position. And I'll be back with you soon. Okay, Patricia, we're going to move on to the next one.
Okay.
So before we position you, let me just do your back
Yes,
up.
please.
Get you secure. So this time we're going to move onto that other side, so you're going to be facing me.
Alright.
It's exactly the same position as on the other side.
Okay.
Are you comfy there?
I am. So it's
Top leg straight down.
top leg straight.
Correct. And then bend this one up. Perfect.
Okay.
You've got it.
Alright.
So like I said, it's a bit of a strange feeling, but it does, as you can see, really expose that target inner thigh area.
Yes.
And that's the bit we want.
Exactly.
Okay. And again, if you just like to put this hand back behind your head if that's comfortable,
Mhm.
and you're fine with that one as it were.
Okay.
If you do need to adjust any of these positions because you're not comfortable, just let me know, that's absolutely
Okay.
fine. I am going to cover your back up with it over your chest. Is that okay there?
That's great.
Perfect.
Thank you. I almost fell asleep.
It's very relaxing.
It really is.
So So you got a rest as well as a treatment.
Spa.
So again, if you just tilt your pelvis ever so slightly away from me this time, that's perfect.
Okay.
The great thing about this is because it's on wheels, as you can see, I'm not having
Right.
you shift all over the bed.
Right.
Are you ready for this last one?
I am. Great.
And that is right where we want it. See you soon.
Okay.
Right, so that is your treatment completed.
Great.
Let me move this up so you can get up. And then it's time for the moment of truth
Oh,
and our second set
yes.
of measurements. Okay. There we go. Right, so here we go. It's
All right,
time
great.
for the next set of measurements.
Okay.
I need
Right.
you in that same position as before, please.
Mhm,
So your
okay.
toes together
Yep.
and your hands up at your collarbone for me.
Okay.
Here we go. It is. So this time I already know where I'm actually measuring for you because of course I've got those reference points from earlier.
Makes sense. Yes.
Exactly, and at least we know we're measuring that same place. Okay, so we have exactly 31 inches.
Great.
Sure this is right. And that is 30 and 3. I might just need to adjust your underwear ever so slightly
yep.
for you, if that's okay.
Mhm.
It's more that little back bit just to make sure we're not distorting that for you.
Okay.
Your arm's okay there?
Yes.
Good. That is 34 and 2. So onto your hips and your bottom. Oops, we'll try that one again.
Okay.
So that is 42 and 2. Now we're going to move on to those thigh measurements. So I will need you just to widen your stance that little bit again.
Okay.
And we'll make sure we are at the same distance. So just slightly wider. Slightly wider. Perfect. There we go, thank you.
Okay. Hands still up, right?
Perfect. You know,
Okay.
you've got it now.
All right.
So that is 24 and 4. Last one.
Just in time. My arms are starting to hurt. I can feel them.
Not long.
That's okay.
Twenty-four and 7. And you can relax.
Great. Okay. I can't wait. I can't wait. Okay.
Well, you don't have to wait long.
Okay.
I'm going to leave you to get dressed and
Okay.
I'll put those measurements together for you.
Great.
And that will be it.
Excellent.
Let's
Okay,
see how we
all right.
did.
Okay, see you in a bit. Okay. Come in.
Ready?
Yes.
Are you dying to hear the results?
I am.
You
I am.
lost 3 7/8 of an inch.
Oh my goodness.
So almost 4
my goodness.
inches.
Oh, I love it. In
Yes.
1 hour.
Exactly.
Oh my goodness.
32 weeks on that
Oh my
ride.
God, unbelievable. I can
I'm
feel it
so
too. I can feel it.
pleased
These
for
are
you.
feel. Oh my goodness, thank you so
You're
much.
so
Oh
welcome.
my goodness, thank you so much. Oh my goodness.
So, do I need to even ask if you're happy to sign this?
Oh, I'm very happy to sign it. Very happy to sign it. Oh.
And just think, this is in one treatment. Where will we be in another 2?
Oh my goodness. I can't imagine. I can't imagine.
Oh, I can.
Thank you so much.
We'll
Thank
see
you.
it soon.
Okay. All right. Thank
Okay.
you. Hi, this is Patricia Mallard, and I am not a paid actress. And in 1 hour, I lost 3 7/8 inches, and I'm very happy. Thank you.